Spices are quite popular, and ginger is a much-loved component in a wide variety of cuisines all over the world. Ginger is praised for its multiple health benefits, which include bringing a spicy kick to our meals, being used in teas and medicines, and being employed in a variety of other applications. Ginger, however, is not appropriate for everyone, just like any other food or beverage. On the contrary, ginger consumption may actually be detrimental to certain health problems rather than beneficial. Ginger should be avoided if you suffer from any of the following conditions. At the very least, you should discuss the possibility of incorporating ginger into your diet beforehand with your primary care physician. Let's talk about it. 12. Gallstones. The cholesterol and bilirubin that are present in bile are the substances that are responsible for the formation of gallstones, which are solid particles that are located in the gallbladder. It is possible that you will experience severe discomfort, nausea, and other digestive difficulties as a consequence of them. It is possible that gallstone problems will become even more severe if ginger is consumed, as ginger is known to accelerate the development of bile. If there is an increase in the production of bile, it is possible that this will lead to the formation of gallstones or the aggravation of stones that already exist. Therefore, if you have a history of gallstones or if you are at risk of getting gallstones in the future, ginger might not be the ideal spice for you to consume. 11. Disorders of the blood. As a result of the fact that ginger is known to possess properties that thin the blood, it is an excellent option for people who are looking to improve their blood circulation. Ginger, on the other hand, may raise the risk of bleeding and bruising for individuals who have blood disorders such as hemophilia or who are taking medications that thin the blood, such as warfarin. Such individuals may be more susceptible to experiencing these adverse effects. The fact that it possesses anticoagulant characteristics contributes to the fact that it has the potential to interrupt the process of blood coagulation, which makes it hazardous for individuals who suffer from bleeding problems. 10. Conditions of the heart. Ginger is well known for its anti-inflammatory properties. However, there is a possibility that it could interact with medications that are recommended for medical conditions related to the heart. Ginger, for instance, has the capacity to lower blood pressure, which may be detrimental to individuals who are already on medicine for hypertension. Additionally, ginger may cause adverse effects on the body. Additionally, ginger, when ingested in high quantities, has the potential to cause irregular heartbeats as well as other cardiac problems among individuals. You should talk to your doctor before ingesting ginger if you are presently taking medication for your heart or if you have a condition that affects your heart. This is because ginger might cause adverse effects on your heart. 9. Being pregnant. Ginger, which is frequently advised for the treatment of morning sickness, is not completely risk-free, despite the fact that pregnancy brings about a number of changes to a woman's system. Ginger use during pregnancy can cause uterine contractions, which can potentially increase the risk of premature labor or miscarriage. Ginger consumption can also contribute to an increase in weight gain. There is no substitute for moderation, and women who are pregnant should seek the advice of their healthcare professional before using ginger as a treatment. 8. Hypoglycemia. Ginger has the ability to reduce blood sugar levels, which might be a double-edged sword for people who have diabetes. In spite of the fact that it would appear to be advantageous, if you are taking medicine to regulate your blood sugar, including ginger in the mixture can result in hypoglycemia, which is defined as having unusually low blood sugar levels. If you have diabetes and are thinking about using ginger in your diet, it is imperative that you keep a close eye on your blood sugar levels and consult with your physician. 7. Disease of the gastroesophageal reflux, GERD. Heartburn and associated symptoms are common manifestations of gastroesophageal reflux disease, GERD, a chronic disorder in which acid from the stomach leaks backwards into the esophagus. GERD symptoms can be made worse by ginger because of its spicy flavor, which can irritate the esophagus. In order to avoid making their situation worse, those who have gastroesophageal reflux disease, GERD, should steer clear of ginger. 6. Inflammatory bowel syndrome, also known as IBS. Constipation, cramping, stomach pain, bloating, gas, and diarrhea or constipation are all symptoms of irritable bowel syndrome, IBS, a common illness that affects the large intestine. In spite of the fact that ginger is sometimes used to calm the stomach, it can actually make symptoms of irritable bowel syndrome, IBS, worse for some people. In the event that you suffer from irritable bowel syndrome, IBS, it is essential to pay attention to how your body reacts to ginger and to seek the specific counsel of a healthcare expert. 5. Reactions caused by allergies. It is possible for certain individuals to be allergic to ginger, which can result in symptoms such as rashes, difficulty breathing, and even anaphylaxis in extreme situations. In the event that you are aware of or believe that you have a ginger allergy, it is imperative that you completely abstain from consuming ginger and seek medical assistance if you do take it by accident and feel symptoms. 4. Drug/medical interactions and interactions. In addition to drugs used to treat cardiac problems and blood thinning, ginger may also interact with a wide range of other medications. Certain medications, such as those used to treat diabetes and high blood pressure, as well as those that are processed by the liver, may be affected by its presence. In order to avoid any potential interactions, you should always make sure to inform your healthcare professional about any herbal supplements or spices that you routinely choose to ingest. 3. Disorders of the digestive system. In spite of the fact that ginger is frequently lauded for its digestive advantages, it may really have the opposite impact on certain individuals. Due to the spicy character of ginger, certain conditions, such as gastric ulcers, might become even more severe. It is recommended that you get the advice of a qualified medical practitioner before beginning a regular ginger consumption regimen if you have any pre-existing digestive conditions. 2. Disease of the gallbladder. In addition to gallstones, ginger can also have an effect on people who suffer from other disorders that affect the gallbladder. It is possible for people who have problems with their gallbladder to experience discomfort and complications as a result of its ability to increase bile production. Ginger should be avoided by an individual who suffers from gallbladder illness in order to prevent the problem from becoming even worse. 1. After the resection. It is possible that ginger will slow down your recovery process if you have just undergone surgical procedures. Because of its blood-thinning effects, it can make the danger of bleeding as well as the healing process more difficult. Ginger should be avoided as much as possible in the initial post-operative period, and you should discuss the matter with your healthcare provider to determine whether it is safe to resume consuming ginger in your diet. Convenient advice for staying away from ginger. For those who are unable to consume ginger, the following are some helpful hints that will assist you in navigating your diet. Take care to read the labels. There are a variety of packaged meals and beverages that contain ginger as an ingredient. Always make sure to examine the labels to double confirm that you are not accidentally taking ginger. Share information with the chefs. You should let the workers at the restaurant know that you cannot consume ginger when you are dining out. You will be able to select dishes that do not contain ginger with their assistance. Try some alternatives. Ginger can be replaced by a number of other ingredients that have flavor characteristics that are comparable to ginger. When it comes to some illnesses, turmeric, cardamom, and cinnamon are excellent replacements that give health advantages without the hazards that are linked with ginger. Exercise caution when taking supplements. Ginger can be found in a variety of supplements, particularly those that are touted for promoting digestive health or inflammation. Before taking any new supplements, you should always be sure to read the list of ingredients and discuss the matter with your healthcare professional. Ginger is an effective spice that has a wide range of positive effects on one's health, yet it is not appropriate for everyone. It is imperative that you exercise caution when consuming ginger, whether you suffer from gallstones, blood disorders, heart ailments, or any of the other health conditions stated above. Before making any changes to your diet, it is important to discuss your options with your healthcare professional. This will help you prevent uncomfortable side effects and keep your general health in good condition. When it comes to introducing potent natural substances like ginger into your diet, it is important to keep in mind that moderation and the advice of a professional are essential. This is it for today. We hope you enjoyed the video. If so, then share your thoughts in the comments and also share this video with your friends. Don't forget to subscribe to our channel and press the bell icon so you can never miss our video.